Shoulder pain after a big hit? Well, it might be more than a bruise. AC joint injuries are actually some of the most common in hockey, and if they aren't dealt with properly, they can sideline you for the entire season and beyond. So let's break down these injuries, how they happen, what they mean, how to rehab them properly, and how to get back on the ice faster and stronger than before. I'm Dr. Jamie Phillips, former professional hockey player, doctor of physical therapy. I own Ghost Rehab Performance in Grand Rapids, Michigan, and I've helped countless athletes recover from various shoulder injuries, but specifically AC joint injuries. And today we're going to talk about how to get you back on the ice faster than ever. So the AC joint, to put it simply, is where your collarbone meets your shoulder blade. And this joint is held together by ligaments. So when you fall or you take a big hit and there's a lot of force on that very small joint, it can create a tear, a minor tear, or a major tear, creating separation of the joint. This is what we call an AC joint separation. And depending on the severity, it can put you out for a couple days or worse, a couple months. There are 6 grades of severity, ranging from a grade 1, which is just a small tear, to a grade 6, which requires surgery. Grade 6s are less common. Most athletes hover between 1 to 3, 3 being a complete separation of the ligament between the joints. So how do you know if you have an AC joint injury? Typically, an AC joint injury occurs after some sort of blunt trauma. So whether it's a hit, or you were run, or you fell onto an outstretched hand, or you took a puck somewhere in the shoulder. Some signs are pain at the top of the shoulder, swelling or a bump right in the collarbone area, pain lifting your arm overhead or across your body. You may also have some weakness or clicking in the joint. With higher grade injuries, you'll see the end of the collarbone sticking up because that ligament is no longer there to support the joint. So the collarbone floats freely in space. It's only protected by your superficial tissue. A diagnosis typically includes a physical examination, an x-ray. If it's more serious, we'd use an MRI, but that's typically for ruling out other possible injuries. So how do we treat it? Fortunately, most AC joint injuries do not require surgery. Grades 1 to 3 are dealt with conservatively using the Peace and Love acronym, as well as a comprehensive physical therapy program. Severe grades 4 to 6, those typically require surgery. The common timelines are grade 1, you'll be back somewhere within 1 to 2 weeks. Grade 2, we're looking about 3 to 6 weeks. And grade 3, anywhere from 8 to 12 weeks, depending on pain and function. Surgery may put you out for several months, but in all cases, rehab is key. The rehab protocol we take at Ghost Rehab is a sport-specific athlete's first approach. Now, I treat primarily hockey players. They take a lot of brute force and high impact to the joints. Sometimes when I have basketball, soccer players, or other non-contact sport athletes, we don't have to worry so much about that impact, although it does occur. I like to use a lot of neurofunctional dry needling to decrease pain and swelling in the shoulder and kind of unlock some of those muscles around the joint that might have spasmed up due to the protective mechanism post-injury. Depending on the phase, we'll use some myofascial release that can be used to break down scar tissue or, again, help relax tight muscles that are around the joint that are limited due to the nature of the injury. Neuromuscular re-education so that we can retrain the shoulder and the shoulder blade and all that glenohumeral rhythms so that everything is moving well during the rehab process, and so that you're less likely to get injured again. And finally, and probably most importantly, is a progressive strengthening program. 1, to help with the stability of that joint, but 2, to really bulk up that active system so that when you go into the corners and fight for a puck or you're battling in front of the net, that shoulder is strong and it's able to handle all the external forces put on it. Every rehab program that we create is always one-on-one. It depends on the severity of your injury, your position, your timeline, your prognosis. I like to make sure that we aren't just returning you to sport pain-free, but you're going back on the ice as a stronger, better athlete than you were prior to your injury. And before returning to sport, we want to make sure that we check a few boxes. The first is we want to have full range of motion and, if possible, full pain-free range of motion. Second is at least 90% strength compared to your uninjured side. And that's something we would do here in the clinic with a lot of different isokinetic testing or using the force plates or dynamometers, different ways to get tangible measurements of strength. And finally is confidence. This is something that's underrated in traditional PT spheres, especially insurance-based clinics where they just are trying to check a box and get you in, get you out, hit your visits, that stuff. Is we really want to make sure that you, the athlete, are confident when returning back on the ice. Because if you're hesitant to go in the corner, you're not going to be the best possible athlete you can be. And oftentimes when we're really apprehensive, we actually put ourselves in vulnerable positions where we can get re-injured again. Now, depending on the athlete, sometimes we refer them out to different sports psychologists or mental coaches to help them break that barrier if that's something that we can't already do in-house. But we want to make sure that the athlete's so strong that they have that internal confidence so that when they start shooting and checking, they are ready to go from the drop of the puck. So with our return to play testing and protocols, we make sure that that athlete has both the confidence and the strength to get back. And we're communicating all the time with coaches, trainers, making sure that that athlete is set up for success whenever they're able to return. So if you're dealing with an AC joint injury, don't wait. The longer you wait, the worse it may get, and you might not have a successful rehab process, and you put yourself at a likelihood of getting re-injured again. I've been on both sides of it as a player and as a therapist, which is one of the reasons why I created Ghost, to be able to help hockey players and other athletes be able to recover from this properly so that they are playing with confidence and without pain throughout the entire season. Drop a comment if you've had a shoulder injury or if you're dealing with one. Subscribe for more hockey rehab tips. And if you're near Grand Rapids or West Michigan and want to book an eval, there's a link down below, or you can go to ghostrehab.com. We also do virtual rehab consultations. So it doesn't matter where you are, we make sure that you're taken care of. And if you like this video, check out whatever videos here. The YouTube algorithm is very smart, and it's probably recommending something that you should watch.